Hey folks, Dr. Timothy Harcourt here. I've been in practice 33 years. We're going to discuss how you can make your toes nice for the summertime. So one of the most persistent conditions is ugly nails. And as much as we don't like to think about it, it's an infection of the toenails. It's a fungal infection. And it's very difficult to get rid of. It's almost impossible to get rid of on your own. Listen, I've heard everything from people soaking their feet in chlorine water, which is not good for you to begin with, to all kind of topical applications. Some people using pliers to rip their toenails off. I don't recommend any of that stuff because that actually a lot of times won't work anyway. And of course, that's extremely painful. We are going to talk about some of the treatments, some of the positives and negatives of different treatments in just a minute. But what's the fancy name for ugly nails? Onychomycosis. Who cares, right? It is a fungal infection, can be very persistent, does affect up to about 15% of the population. And it affects all ages. So it is more prevalent in the elderly, but it affects any age group. It's especially prevalent in beach areas like Fort Myers Beach, Sanibel, those type of things. It's thought that a lot of times the fungus originates as athlete's foot and then moves into the toenails. So let's talk about this for a second. If you think you only have a fungal infection on one foot because the nails are discolored on one foot but not on the other, guess what? You have cross-contamination. So anytime treatment is done, it's always done to both feet for that reason. We're just going to do a real quick research review because I'm not going to spend a lot of time on that. We'll get right down to the practical stuff. But about 50% of all nail disturbances actually come from a fungal infection. That's pretty significant. And Schleifman found that at up to 2 to 13% of people are affected. I think in this area, it's probably higher just because we live in a warm, moist environment. Guess what fungus likes? Warm, moist environments. That's what it likes. To kill a fungus, you got to take away the moisture and you got to heat it up or do something to it. So that's basically what the treatment is. So we'll talk about that in just a minute. As far as people ask all the time, why is it just my toenails? How come it isn't my fingernails? Well, it's 4 times more likely to be in a toenail than it is in a fingernail. We almost never do a treatment on fungal infections of the fingernails. There's a couple reasons for that. Your feet are usually stuffed into a shoe of some sort for a big part of the day that holds the moisture in. So that is a big reason why. And then the next thing is the fungus gets in your shoe, so you put it back on. And it keeps recontaminating your foot. For that reason, we actually recommend with the treatment to buy new footwear. You don't have to buy all new footwear and throw all your shoes out, but at the very least, you have to treat your shoes. And if they're untreatable, then you're better off just getting new footwear, okay? So what is the treatment? We do laser treatment here. Now there are oral antifungals you can take, but they tend to be very renal and hepatotoxic. What do I mean by that? It can attack the kidney and the liver. So if your doctor does get you on those medications, ketoconazole kind of thing, they usually do a liver enzyme test on you like every other day to make sure you're basically, it's not killing your liver. So it's very dangerous, essentially, in a relative standpoint, it's more dangerous to take the oral antifungals than it is to do the laser. So we do the laser here because it doesn't put your kidneys and your liver at risk, and it's generally very effective. Let's have a practical talk now. What's the practical part of this? Listen, a lot of people are going to battle toenail fungus in their lifetime. And it's one of the more persistent conditions that walks into our office. I mean, it's next to impossible to get rid of by yourself. I'm not sure that I've ever had a patient tell me they were able to completely eradicate their toenail fungus on their own. So it's also unsightly. They, yellow, ugly, gnarly toenails just don't look that good. So, well, if you live on the beach, you want to be able to go out in your flip-flops and sandals and different things. So obviously it'd be nice if your toenails look nice. Once somebody has ugly nails or a fungal infection of their toenails, they pretty much don't want to get it again. And so there's some ways to help keep it away once you get rid of it. And of course, at the beach, there's a lot more opportunity to have your toes out in the sun. Some people have asked, well, can't I just lay out in the sun and get rid of it that way? I wish it was that easy, but it really is not. What we do is essentially concentrate the sun and burn it out of your toe. That's what we do with the laser. What are the benefits of the laser treatment? It's relatively quick. It's 10 minutes per foot, and we always do both feet. So prep, treatment, post-treatment, it's about 30 minutes. So it doesn't take real long. It does get warm. When we're doing it, your toenail will definitely heat up. We do see smoke coming off your toenail a lot of times. That's basically the fungus getting killed. So, you know, it's a very effective treatment, but then you have to do the things on your end too. You don't want to recontaminate all your toes that you just, you know, killed the fungus in, so on the toenails. The side effects are relatively small compared to oral antifungals. I mean, there's really no significant side effect with the laser. Cost is very reasonable when you consider that if you do the oral antifungals, you could need a liver or kidney transplant. Well, that's well over $100,000, probably more like $300,000 or $400,000, who knows. I don't even know what that cost is, but it's extremely expensive. Let's talk about treatment now. What is the protocol? We treat each foot, each time, okay? So if you come in and you say, well, I only need the 1 foot done, we won't even do your treatment because we know better than that. You gotta get both feet done. Whether you think it's infected on the other side or not, it is. And the cross-contamination will hold the other foot back. Total time, like I said, is about 30 minutes. We do it at least once a month. The average case is 3 to 4 treatments at a 30-day interval. Why do we wait 30 days? Why don't we just do 3 or 4 treatments in 1 week? The reason for that is you have to let the nail grow out, because what happens is the fungus will grow backwards. And if you're not killing it as the new nail comes out and keeping it away, it'll just recontaminate the new nail. So some people require longer treatment. Like if they have a severe infection of their toenails, it takes longer for them. So it might not be 3 treatments, it might be 6 treatments. You know, it just depends on your situation. And, you know, the longer it's there, the harder it is to get rid of. But it's still, the laser will definitely kill the fungus. So what type of laser do we use? It's a high dosage Diowave class 4 laser. So with a special applicator. The applicator is made just for ugly toes. And you know, it's a wonderful treatment. It is fairly comfortable. I mean, the only thing that's a little uncomfortable is that your toe definitely heats up. But we never put it at a level that you can't handle it. The cost is $80 per foot or $160 per treatment, with a minimum of 3 treatments. Sometimes it takes 6. And for limited time, we're going to offer a no-charge consultation to see if we can help you out, to see if we can help get rid of your ugly nails. Of course, we have to make a diagnosis first and make sure that that's something that you do have that will respond to the treatment. You can put questions in the comments on YouTube, and we're happy to do that. And so I hope that this is beneficial to you to understand what onychomycosis is and how you can get rid of it and how you can do it safely. So for now, it's Dr. Timothy Harcourt signing out. Thanks so much for watching the video. You need to go in a different direction? Call and we'll have a sit-down, no-charge consultation.
Thank you so much for watching. Please remember to like this video and subscribe to our YouTube channel. Also, check us out on Facebook and Instagram. Links are down below.